Greetings everyone and welcome to Season 2, Episode 7 of IVSA Kelantan podcast show. Today we're glad to have Dr. Kat Henstridge with us to share about veterinary geriatric in small animal practice. Dr. Kat graduated from Bristol Veterinary School in the UK in 2003 and has worked ever since as a small animal first opinion vet in the UK. Her clinical interests include internal medicine, geriatric care, and client communication. She also enjoys writing and started her own blog of veterinary advice back in 2010. She then went on to create a social media page as Kat the Vet, where she shares news and information from the veterinary profession, combats misinformation, and creates educational posts for her pet owners. We truly appreciate Doctor for joining our podcast show. So how are you doing today, Doctor?
I'm really well. Thank you very much for asking me to take part. I'm delighted to be here.
Alright, Doctor. So for my first question is, can Doctor explain to us briefly about veterinary geriatric and what made Doctor interested to pursue in this field of studies?
I think we all love older pets, don't we? And I think that, when an owner has had an animal for a significant portion of that animal's life, they're very attached to them and they love them very much. But sometimes they don't always appreciate the changes that happen as their pets get older, or they maybe don't appreciate quite how, at what stage their pets are in life. And we can make such a huge difference to our older animals by just caring for them and just paying that, a little bit more attention than we maybe do when they're younger. And we can really give them a brilliant quality of life and help that relationship that they have with their owners to carry on in a really positive way for as long as possible.
Alright, Doctor, thank you so much for answering my question. So for the next question, I will pass it to Natalia.
Thank you, Jaya. So for the next question, what are some signs or symptoms that may indicate age-related cognitive decline in animals?
So age-related cognitive decline is really interesting, and it's something we're learning more about all the time as vets, never mind the owners. And I think that a lot of the signs are put down just to sort of old age, and owners maybe don't appreciate what's happening with their animals. But also there is some research to suggest that owners do appreciate. So there's various, different owners have different attitudes, don't they? But there's some evidence to say that owners do appreciate that there's something not quite right with their elderly pet, particularly their elderly dogs, because an enormous proportion of our dogs over the age of about 12 will have some form of, cognitive decline. It's often parallels are drawn between it and Alzheimer's in humans. They do sort of get the impression that there's something not quite right, but because often you can't really put your finger on it, you can't really identify exactly what's wrong. The dog just kind of sleeps a bit more, or maybe just looks a bit confused, or hangs back on walks, or you give them a command and it takes them longer than it used to do it, whether it's sit or come, or the door opens and then they stand there for a couple of seconds before they walk through it. It's very difficult for owners, to sort of articulate those changes to us. And, when they come for their checkups and we say, how's he doing? They go, oh, he's fine. He's just getting a bit old. And it's hard for them to even tell us there's a problem, even though that maybe know that there is. So sometimes the vets really have to say, how is the sleeping? Loss of sleeping patterns is a big one. They're getting up in the middle of the night and wandering about or disturbing the owners. That's one that owners definitely won't miss, and they'll be like, what's going on? But maybe won't think to ask us for help. The other big one is, a loss of toilet training. So, more accidents and things in the house with wees and poos. But again, that's not one that's going to be missed. That's going to be fairly advanced. I often say to my owners that, we pick up on elderly people having memory problems and communication issues very early, because you have a chat with your granny and you realise quite early, quite easily that she's not quite, she's told you the same thing a couple of times over, or she asks you a question that you've just given her the answer to. But for dogs, it's kind of the equivalent of finding granny in a nightie in the local supermarket, you know, when you just really realise there's a big problem. And it's often not until things become very obvious, particularly with dogs. I think most of the research that we have so far is in dogs. Not until it becomes that obvious that owners realise there's an issue. But the problem is it's not an easy disease to fix. And if we can pick it up at the sort of mild confusion stage, we're going to have a much better chance of making it better or having some impact on improving the situation.
Thank you so much, Doctor. For the next question, how can we ensure the overall comfort and quality of life for geriatric animals?
We can do so much for our older pets, and I think it's really important that we're very proactive about it, because like when you have conversations with owners, you do get some that are just like, well, he's old and I don't want to do anything and he's just old, and you know, this is just how it is now when they're slowing down or they're arthritic or something like that. So sometimes you can't do something, and sometimes those conversations are a little bit awkward because they don't really perceive that there's an issue other than the fact that the animal is old, and therefore what they think is happening is very normal, whereas we have to be quite proactive for some people in saying, actually, I think there's lots we can do. Let's do some pain relief. Let's do some changes in diet. Let's get some memory supplements on board so we can get them working a bit better, some antioxidants and stuff. But actually, a lot of owners are very proactive, and if we bring it up and say, well, okay, now they're coming into this stage of life, this is going to happen, we should make these changes for them. So, and especially if we can have a relationship with our clients, you know, where, I mean, it's wonderful when you see the dog as a puppy or the cat as a kitten, and then if you stay in the same practice and you develop that relationship, so when the animal gets to more senior years, you can start opening up that conversation about the changes we might start to see. But, you know, even if you don't have that length of relationship, you can still have a conversation maybe when they're 6 or 7 and say, did you know they're now the equivalent of a person in their 60s or 70s, and we are going to need to make some changes. And I always think, especially with client communication, relating it to the age of the person is really helpful, because they've got a 7 or 8 year old Labrador. The dog's probably still quite active, but when you say to people, actually, he's kind of, in his late 50s now, it really does relate it a lot easier. And again, those concepts of aging, and, we're not suggesting that you put your dog in a wheelchair and cover them with a blanket and leave them there, but there are changes we can make. And there's some really great charts. If on the ISFM website, there's one for cats that equates cat ages to human ages. And there's a brilliant one, I think it's by the American Kennel Club, but there's quite a few versions of it for dogs, and that relates the dogs, because obviously dogs are more variable in their size. So it does the different sizes of dogs and then the different ages and how that equates. Anyway, to get back to your original question, which was, what can we do? Absolutely loads. I think the first thing we should do, particularly from the veterinary perspective, is we should be making sure we're getting our patients as they enter those senior years. And so, from that human age equivalent of, 60s or so at the very latest, in for more regular checkups. So here in the UK, we vaccinate our animals, our cats and our dogs, on an annual basis. We vaccinate them against fairies, but we see them once a year. And in younger animals, that can be okay. We don't, if they keep themselves out of trouble and we don't need to see them for a whole year, that's not the end of the world, although I do prefer a 6-monthly checkup all the way through life. But we definitely should be seeing them at least once every 6 months when they get older at that age. And, it doesn't have to be the vet, we've got brilliantly strong nursing teams who can do a general checkup. So first of all, we need to be seeing them on a more regular basis. Ideally once every 6 months, I think, possibly even more frequently. And again, sometimes you get some resistance to clients for that because they don't want to make the time to come, or they don't want to spend the money to come. Again, if you relate that to human terms, and you go, actually, in terms of humans, maybe that's like 3, 4, 5 years between you seeing your physician as a person. That's a long time. And again, I think that really helps. And then in addition to physical examinations, we should probably be doing some annual blood tests at least. I think they're very well established in America. Americans are brilliant at preventative ongoing healthcare. And I think it's because, I don't know what it's like for you guys, but I think it's because so much of their healthcare is private. They get a lot of human healthcare like that, a lot of preventative and checking. Whereas in the UK, we're not quite as good at that, but it's getting better. So I think annual bloods Urinalysis is often something which is overlooked, but really important. Very cheap, relatively easy for dogs, not as hard as owners think it is for cats. But we can get an enormous amount of information about the health of the animal from a very simple, cheap urine test. And then we shouldn't forget the value of the physical exam. What do their teeth look like? Do they need some dental work doing? That's very, very common as they get older. Let's get them heading into their geriatric years when anaesthetic risks do rise with good dental health, so we don't get to that classic 12, 13, 14-year-old dog where the teeth are awful. And, they'll come through the anaesthetic. Anaesthetics, relatively speaking, are still very safe, but it's a bigger job and it's a bigger sell to the owners as well, because they start to worry about anaesthetics. So the physical exam, listening to their hearts, picking up heart murmurs early. In terms of things like arthritis, muscle condition scores are brilliant. And I think we're all very good at body condition scoring, but I think we could be better at muscle condition scoring. The WSABA has a great guide for that that's free for everybody on their website, because that really helps us pick up on, arthritis. An enormous proportion, 80, 90% of, well, basically 100% of geriatric animals will have arthritis, but over the age of 12, 80% of cats and dogs have arthritis. So picking up on those signs really early is helpful. So I think that from a veterinary perspective, it's just about seeing our patients, monitoring our patients, keeping those conversations open with clients, saying, well, his eyes are fine now, but cataracts could be quite common as they get older, and that's another reason why we need to check. And I think one thing you end up doing, once you've graduated and got into the real world, you'll develop a pattern. You just sort of develop as you're doing things, once you're confident in what you're doing, you can talk to the client at the same time and keep that conversation going and prep for the future. Because I think sometimes, and I can understand it myself, from a client's perspective, if a vet suddenly goes, well, your dog's 10 now, so we need to do annual bloods, and it's probably got arthritis, and his heart sounds a bit dodgy, and we probably need to do some dental. It's quite a lot, but if we've prepped them over time to be ready for the changes, they're already on board, because the biggest barrier to helping our patients as vets is often, unfortunately, the owners. And it's not because they don't care, it's not because they don't want to help their animals, it's often because they just aren't quite on board with the concept or quite understand why. So the more we can do, the better. And then the other aspect to your question is what can we do for them? And I think there's a huge amount we can do for them in the home. They spend 10 minutes twice a year with us. They spend all their time in their home. So I don't know if you guys are aware of a website called caninearthritis.co.uk. You may be. If you're not, bookmark it. It's brilliant. Arthritis is incredibly common in older animals, as you know, and they have the most enormous amount of resources on that website for owners of all the different things they can do in the house to help them. So it's like putting mats down on slippery floors so they don't fall over and they can keep their balance. Blocking off stairs so they can't go up and down stairs, or making stairs easier for them. Nice deep soft beds for our cats, considering heated beds or heat mats for their old joints, keeping all those resources they need very close, so their water and their litter tray and their food spread out. Obviously, as you know, those resources need to be spread out. Nobody wants to do a poo next to their food bowl, but where it's easy for them to get to, litter trays that are low down for them to step into, litter in the tray that is sand-like and soft, so it's okay for their paws, they're not hurting themselves. And sometimes with the dogs, to go back to dogs, you do need a bit of a mind shift, because here in the UK, people get dogs and they take them for walks, and they take them for long walks through the countryside. And sometimes you have to say to people, I don't quite think they can manage what they used to, and that's a big mental barrier for a lot of owners, I think, because they've got this dog, they want to go for long walks, and suddenly the dog's not able to cope. So you have to sort of say, right, well, I'll tell you what, maybe don't do lots of hill work, but you could probably manage, something on the flat, on a soft ground. Is there a walk you can start to do that's not quite so challenging, and the ground's a bit softer on these paws, and can you stop a bit more often? So there's lots and lots of, and that's things we can do. And that's why I think it's a really fascinating area. I mean, I work in general practice. I don't particularly specialise in geriatric animals, but a lot of my patients are elderly. And I think it's just brilliant that we can do so much to give them really good quality of life in their old ages. And our management these days of chronic conditions is brilliant. You know, we're light years ahead of where we were even 10 years ago. And I think there's just such a lot we can do.
Thank you so much for the explanation, Doctor. Next, I will pass it to June.
Thank you, Natalia. Alright, Doctor. For my next question is, how often should geriatric animals undergo health checkups and wellness exam, and what specific tests or screenings are typically performed during these visits?
So I think we need to be seeing our senior patients at least once every 6 months. And more often if we have diagnosed an issue like arthritis or heart disease or dental disease or anything really, you know, cataracts or whatever. But I think once every 6 months is a good idea, and that can be a whole team approach, you know. So in the UK we have our veterinary surgeons and our veterinary nurses, and veterinary surgeons are the ones who prescribe treatment and make diagnoses, but our veterinary nursing teams are very capable of doing physical exams, of taking blood, of looking at urine and reporting the results to their vets. So I think once every 6 months is great. They can also do blood pressure, because of course hypertension in elderly cats is very, very common, you know. So, and we should be running through these tests and repeating these tests on that regular basis, whether it's once every 6 months or you know, once every 3 months or whatever is deemed, you know, appropriate. And that will change for the individual animal, and it will change throughout their lives as well. So again, it's about having the time to just talk to the owners and making them understand where you are now, but also where you might go and what might the plan be for the future as well. So yes. And on the ISFM website, so the International Society for Feline Medicine, and cat care is the other brilliant one that they do. Somewhere on there, they've got a schedule for cats, you know, and I think from about maybe ages 7 or 8, they advise annual urinalysis, and then as the cat gets older, they add in blood pressure checks, and as the cat gets older, they add in regular blood tests. So it's nice to have something like that to refer to. And often information to like print out for owners and things. Obviously, those resources are all in English. I don't know if you guys have it in your language or if there's translations. So yeah, I think, you know, we should be seeing them on a regular basis. We should be doing urinalysis. We should be doing blood tests. We should be doing blood pressure testing. Dry eye testing is another one, which I think is a really good idea if you're going to do sort of regular geriatric testing. You know, there's a surprising amount of keratoconjunctivitis sicca in our elderly dogs that we miss on a low level. So yeah, those are the tests that I would be doing, and then of course off the back of those, that's when you're going to be starting to do dental work, cardiac workups. You know, you're diagnosing chronic diseases like hypothyroidism, renal failure, that sort of thing. And there's an enormous amount we can do to monitor and maintain those conditions.
Thank you, Doctor, for the detailed explanation. For my next question is, since doctors specialize in small animal geriatrics, what are some of the biggest challenges you have had to face during your years of experience?
Well, I think with respect to older patients, the biggest challenges I think are persuading owners there's a problem. You know, it's a real art, because sometimes a lot of owners, I think, are a bit resistant to suggestions, and they're a bit resistant to testing. And I think, you know, often they think, oh, it's just to make some money. This just, you know, it's not necessary. Sometimes they think, well, I don't know what she's talking about. My dog is absolutely fine. You know, chronic disease is subtle in its presentation. These dogs aren't crying and screaming when their joints hurt. They're still eating even though that their teeth are awful. So, and owners sometimes are really looking for those very obvious signs of a problem and you say, well, I think they're in pain, and they think, well, no, they're not. They're fine. So it's that persuading of owners that there's a problem, because of course, once you've diagnosed a problem, then you've got to do something about it. And you know, and that expectation of what an older animal should be like and how their lives should be. So I think that's a big challenge. And then I think the second challenge is with respect to older animals, is they can be quite difficult patients to manage in terms of like balancing different diseases. You've got arthritis and you've also got kidney problems. What drugs should you pick? There's some work been done by Sarah Caney in the UK, so we now know that we can use non-steroidals with kidney disease in cats without very many problems at all. But I think a lot of us are still quite nervous about that. Or they develop, gastritis from chronic non-steroidal use, which is, unfortunately quite common. What do we swap them onto? If you're going to be anaesthetizing an elderly patient, there's a lot of pressure, isn't there, to make sure that the anaesthetic goes well and everything's fine. And it's an elderly and adored animal, and that's a big pressure, a big challenge. And then I think the other thing that we shouldn't underestimate the challenge of is end-of-life care and euthanasias and that sort of thing, which is a huge part of what we do as vet professionals. And that's a time when you get one chance to get that right for that animal and that family. And especially when you're at the beginning of your career, it can be really daunting. At the end of the day, it's going to go well because you're going to get to the outcome you're after. But to make sure that those appointments and those moments that they'll never forget go smoothly it can be quite a daunting task.
Thank you so much, Doctor, for sharing your experience and challenges that Doctor have encountered in this field. I will pass the next questions to Jaya.
Thank you, June. So, before we end our session, is there any take-home message that Doctor would like to share to the public, pet owners and vet students?
Yes, I think just to go back to what I was talking about euthanasias and end of life, I think that as vets we are not very good at understanding how much owners think about that and how much they worry about it. And again, there's been some really interesting research being done in the UK by a lady called Zoe Belshaw. If you ever get a chance to look at her work, it's fascinating. She does a lot of work about communication and communicating with pet owners. And whenever we diagnose a chronic condition in an animal, particularly like arthritis or heart disease or something like that, one of the thoughts that the vast majority of owners have in their head is, when will this end? At what point will this disease become overwhelming and I'll have to, say goodbye to my animal? And as vets, we know that that's ages away. We're like, well, we can manage and you can live with arthritis and have a great quality of life for years. And the same with, renal disease and hypothyroidism and heart failure and stuff like that. We know that these animals have got a reasonable length of life left. With heart disease, we've got the EPIC trial, so we can actually say, the average survival time is like 500 days or something. That's quite a significant length of time. But the owners don't know that. But they don't want to ask us because they don't want to articulate that to us. They don't want us to think that they're just writing their animal off and that they're just, and also they don't really want to talk about it because it's kind of morbid, but it worries them. So I now make the point, whenever I diagnose an animal with any chronic condition, of having a very short conversation, something along the lines of, this is a condition which we now have diagnosed, it won't go away, but we are going to be able to control this for years. There may come a point that we are no longer able to control it, and we will need to that stage to make those end-of-life care decisions. However, that is a long time in the future. And we're going to keep that, and you keep that conversation going, and you see them, and you don't need to talk about death at every appointment, but I think every so often it is worth just reiterating that how are they doing? She's doing really well. We've been going at this for months now, and I see no reason why we won't carry on for years like this. Because that, I think that's the one thing that it's very, it's euthanasia for vets is something that we're very proud of. It's a big part of what we do here in our world. People say to you, don't know, I couldn't be a vet because I couldn't put animals down. And then you feel a bit awful when you say, actually, it's one of the best parts of my job. Not because I like it, it's because giving animals a good death is a gift and it's a wonderful thing. But I think owners, and we need to talk to owners about it. So that would be from this particular subject for this particular podcast. Talking to you guys as veterinary students who are going to go out into the big wide world and concentrating on geriatric care. Don't forget to talk about the end, even if you know as a veterinary professional you're miles off, because your client will be worrying about it. They know their animal's older, they know they're not going to be around forever, and part of our skill and our guidance for them is to talk to them about that. And again, we've talked about prepping them for lots of problems, and we should be caring. The euthanasia is not just in that moment at the end. There's a lot of talk coming up to it, and that's part of the skill and part of our care.
Thank you, Doctor, and that is all, folks, for our 7th podcast episode. In conclusion, our podcast on veterinary geriatrics has been a journey into the world of aging pets and the unique challenges they face. Through our discussion with Dr. Kat today, we have explored the importance of specialized care for senior animals and the impact it can have on their quality of life. Throughout the episodes, we have shed light onto the various health issues that commonly affect aging pets. We have also delved into the importance of regular veterinary checkups, early detection of age-related problems, and the implementations of tailored treatment plans to address the specific needs for geriatric animals. We invite you to stay connected with us as we continue to explore new topics and delve deeper into the world of veterinary medicine. Thank you, everyone, and take care.